For our case study of cirrhosis, we have a 46-year-old white male with a history of chronic alcoholism and alcoholic cirrhosis. Unintentionally gained 15 pounds during the past 4 weeks, and the patient has not been sleeping well and has been feeling very lethargic, and a remark came about unusual and violent behavior of that patient on the job. So question 2 asks about clinical manifestations consistent with the diagnosis of cirrhosis in this patient. The confusion, the disorientation, the strange behavior, the difficulty answering questions. This can point to early hepatic encephalopathy manifestations. Stomach swelling, distended, firm, tender abdomen. This can point to ascites and bacterial peritonitis. Sleeping poorly, feeling lethargic, memory loss, again, parts of hepatic encephalopathy. Personality changes, loss of temper. The mildly jaundiced patient again points to the loss of detox function of the liver. Spider nevi, ecchymosis, gynecomastia, hepatomegaly, splenomegaly, atrophic testes, hemorrhoids, asterixis, which is fine tremors of the hand, prominent veins around the umbilicus. All these are manifestations of liver cirrhosis in this patient. What's the most significant abnormality that this patient's CBC has revealed? Low platelet count, low platelet count. This means what? This big spleen is destroying the tiny platelets, and the platelet count is going to be low, and this will put the patient at high risk for bleeding. Question 5, based on the lab data, why has the patient's cirrhosis shown a sudden and unexpected progression? Even though the patient stopped abusing alcohol 5 years ago, but his cirrhosis has already begun. And now it's showing worse progression, because this is the case with hepatitis C. Hepatitis C tends to be asymptomatic when it first happens, when it first occurs, but it tends to take a chronic course that lately will present as destroyed fibrotic cirrhotic liver, and the complications will develop and the liver function reserve is lost, and this is when you develop the manifestations of cirrhosis. So this patient is positive for hepatitis C, and this is the cause for his worsening condition. Question 6, identify 4 risk factors that may have contributed to the patient's current condition. The heavy alcohol use, of course, the intravenous drug abuse, which transmitted hepatitis C virus to the patient, and the intranasal cocaine administration and blood transfusions. Question 14. Which single lab test strongly suggests that the patient has developed hepatic encephalopathy? The most important test is elevated what? Serum ammonia. Too much ammonia in your blood. This points to hepatic encephalopathy. Now, the case of esophageal varices, this case focuses on the bleeding, GI bleeding that comes out of the dilated tortuous veins at the lower end of the esophagus. Again, what's the commonest cause of esophageal varices? Portal hypertension. And what's the commonest cause of portal hypertension? Liver cirrhosis. 62-year-old male has been admitted to the hospital for treatment of acute gastrointestinal bleeding. A similar episode occurred 5 weeks ago. Upper endoscopic exam done 5 weeks ago revealed a bleeding esophageal varix, for which the patient received band ligation therapy. The patient is known to have a drinking problem, and the past medical history, this patient has been treated for alcohol withdrawal seizures, ascites, coagulopathy, esophageal varices, peptic ulcer disease, anemia, gastritis, all of which, as you can see, were related to his alcohol abuse. And the physical findings in this patient showed positive spider angioma, and markedly jaundiced, and positive gynecomastia, and positive splenomegaly. So question 4 says, what's the significance of the liver enzymes, AST and ALT? These test results tell you what? With liver disease, the hepatocytes are injured, and the intracellular liver enzymes will leak to the outside. So this concentration of liver enzymes, when it is elevated, when the liver enzymes are high, this points to the severity of liver disease. This says that you are damaging more and more liver cells. By the way, elevated liver enzymes do not tell you the liver function. What tells you the liver function? The low albumin and the high prothrombin or high INR. The elevated liver enzymes will only tell you the liver cells are being destroyed, are destroyed. And another important remark, the day you die of liver cell failure, your liver enzymes might be normal. And the reason of this, now you have no more liver cells to damage, you have no more liver cells to destroy, so your liver enzymes will actually drop. But this does not tell that you have been cured of your liver condition. This means simply your liver condition has just killed you. Question 5 says, what is the significance of the bilirubin level test results? We have increased level of both types of bilirubin. Direct bilirubin will go up because of some edema in the biliary canaliculi inside the liver. Some effect of this fibrosis will result in some obstruction to the bile passage outside the liver. This will increase the level of direct bilirubin, and at the same time your liver cells are not functioning, they are not turning indirect bilirubin to direct as effectively, so your indirect bilirubin will also go up. So we get elevation of both types of bilirubin, and we get elevation of your total bilirubin, and this will result in jaundice. Question 9, what is the explanation of the patient's elevated blood glucose concentration? Why do we see hyperglycemia in patients with liver cirrhosis and esophageal varices? The hemorrhage and the significant blood loss is what? Major stress. In any stress, what do we get? Stress hormones. Catecholamines, cortisol. Both of them elevate your blood sugar. Question 11, what's the purpose of prescribing lactulose for patients with chronic liver disease? Lactulose is what? Lactulose is a laxative. Why do we prescribe laxatives? Now, think of it that way. When you have bleeding from esophageal varices, the blood is going to trickle downward, so you have a lot of blood to vomit, but some blood also will pass downwards to your intestine. Now you're going to have a lot of blood in your intestine. What does the blood have? The blood has hemoglobin, and the hemoglobin is made of protein and heme. The protein is going to be metabolized by the bacteria inside your gut. A lot of ammonia is going to be released, and this ammonia will knock down your brain. So you want to make sure that you do not keep the blood in your gut. So you want to have something that takes this blood out. And this is why we're going to give you lactulose as a laxative to take this blood, to clear your gut out of the blood, so that we decrease the probability of having hepatic encephalopathy.